Hi, students. How are you doing? Welcome to Seminar. I hope you are great. I am sure you all may have seen videos circulating around about some professions no longer being a professional profession, right? Or a professional degree, according to this administration. Because I don't know, a whole lot is running through my head, but I don't know how people that are directly affected by this, I don't know how they are feeling. I don't know how they woke up because at this point in time, it is screaming. I just want to make some people voiceless, make some people's voice voiceless and all of that. And if you look at most of the professions that were affected, there are mostly professions that are being handled by women. So which means a lot will start happening. It's either you are no longer earning what you are supposed to earn, or that you will never get increments anytime, any day, or there is going to be reduction in your salary. Why? Because the profession is no longer a professional degree. Like, what nonsense is this? On a very serious note, I am still trying to wrap my head around this administration and how chaotic and clumsy they are. But this particular one, I did not see it coming anytime, any day. It is hard. Let's get into this video.
They're all mandated reporters, by the way. They're all mandated reporters, by the way. All of the professions that is stated in this new Department of Education proposed rule that is set to take place effective July 2026, stating that all of these professions are no longer professional. Yeah, they're all professions that are mandated reporters. Every last one of them. Nurses, teachers, social workers, therapists, all mandated workers, every last one of them. What the Trump administration is doing is not just an attack on female dominated fields, but on the actual victims themselves. Like, he's literally trying to make sure that he could further silence y'all. And this is all going to be a domino effect, okay? In the last video, I already talked about it with the nurses, okay? By limiting nurses' access to higher education, that is going to directly impact the patient themselves, okay? Not just that, it's also going to deter a lot of people from entering that field, or those who couldn't get into that field without the financial help, without the financial backing. So therefore, decreasing the overall number of nurses. Again, this is going to impact the patients. Same thing for this. By no longer considering these professions as professional, they no longer qualify for the federal backing that's needed to help so many people get into these fields. Therefore, the actual fields are going to shrink. They're going to decrease. And by decreasing these departments, you're also simultaneously decreasing the amount of mandated reporters that are available. So now the victims have less and less resources available to them. And the attackers, they're able to just live their lives unscathed. Considering the current allegations surrounding the president, considering his past of making statements of just, all you got to do is grab her by the, you understand? Even this year alone, he stated that domestic violence amongst married couples, wife and husband, shouldn't be considered domestic at all. It shouldn't be considered violence. And in fact, law enforcement should not be involved. Now it makes sense. Now it makes sense because, again, not only are these female-dominated fields, meaning not only were the mandated reporters more likely female, females are the people that are more likely to take attacks or domestic violence or abuse seriously. Now it makes sense.
Nursing is not a professional degree anymore, so let's talk about it. We can all be rage baited into this, or we can think about it professionally and tactically. What is listed as a professional degree? Medicine. Have you ever thought about what medicine would be like if they tried to do medicine without the nurses? Like, what would that be like? What if the medical world was just the doctors? I'm just saying. Like, if the medical world was just the doctors and the nurses we're not a professional degree, so see ya. All I'm saying is, I don't care if you consider my degree professional, because if I was in this for the glory, I would not be here. I'm not here for that. I don't think any of us are here for that. What we are here for is to take care of our patients, to be able to pay our bills, to be able to afford to live, and to impact people's lives. And here we very serious right now. What does this affect? This affects access to loans for people. For those degrees, those upper degrees, nurse practitioners, CRNAs, things like that, that would be undoable for most of us. Why do we start nursing? For the go-getters, a lot of us, we go into nursing to go higher. And who does that affect? Your critical care nurses. Those are, a lot of us are the ones that are like, I want more. I want to be an NP. I want to be a CRNA. And there's some people in here that are taking the route of saying, y'all got hoodwinked, because now you're in a flooded nurse practitioner field and you're not really making that much more. And now look where you're at. Okay, fine. And like the CRNAs aren't mad about that. No, I think if they were in the middle, they would be mad, because now you can't get degrees to finish your job, your field that you went into. You can't go to CRNA school on $20,500. Can you? No, you can't. So riddle me this. Can we do medicine, the professional degree, the professional field, without the nurses? At the end of the day, we have turned hospitals and medical systems into big business America, and that is the problem. That's why no one is seeing ER wait times get better. That's why no one is seeing insurance go down. That is why no one is seeing care get better. That's why when a patient gets a hold of a nurse and almost kills her, that patient gets let go and the nurse gets drug into the manager's office in a body cast and says, what could you have done better? Because it's about the money, not the care. It's about the dollars. That's why you sit in an ER for 25 hours waiting to see a physician, because it's about the money, not the care. That's why this whole conversation is happening. And if this continues, it's only going to get worse. If they push this through, people aren't going to go to nursing school. Why would you go to nursing school? If somebody looked at me, if I was at the beginning of this track and somebody said, you're not going to be able to afford to go further, and this degree was at the end of COVID, not the beginning, and I was getting treated the way I am now at the beginning of my nursing career, it would be a lot to think about, because this has changed a lot. But I think the question is, can we do medicine without the nurses? I don't know.
Nurses are not professionals. Now, hold on, before you get really upset with me, that's not me saying that. That's the Trump administration saying that. The Department of Education has labeled that nursing degrees are no longer professional degrees. But don't worry, because theologists, they are professionals. That degree, that got bumped up to a professional degree. Make sure all your nursing friends know that the Trump administration doesn't think that they're professionals.
The Department of Education recently made one of the dumbest decisions ever regarding healthcare. They decided that nurses, nurse practitioners, physician assistants, occupational therapists, and physical therapists, among others, are no longer considered professional degrees. Not only is this extremely insulting to some of the most integral healthcare providers that we have, but will also likely impact staffing of these types of practitioners. We're currently facing an extreme nursing shortage, and it's only going to get worse over the next several years. Now, there are a lot of reasons for this, but one big one is burnout. Surveys show that 4 in 5 nurses face extreme stress while at work. And this has only been made worse after the pandemic, where you get stupid people who don't respect them and will even assault nurses. And staffing shortages, partly caused by poor reimbursements from insurance companies to hospitals, cause these nurses to have to handle many more patients than they can safely handle. Now, on top of that, the Department of Education, headed by former WWE executive Linda McMahon, is now calling them no longer professionals. And this will limit the amount of federal student loans that nursing students can take out. Now, this can't make the nursing shortage worse, could it? Now, the fact is that nurses are the most important part of the hospital system. Yes, even more important than physicians. If all the nurses were to quit their job today, the hospital system and healthcare would fall apart literally within minutes. But if you think about it, if all the doctors would quit today, then nurses can actually keep this shit going for a while. And then you take physical therapists, all of them whom now are required to get a doctorate in physical therapy to practice. They too will be limited in the federal student loans that they can take, so that they literally will not be able to actually pay for schooling. I think Linda McMahon may have had too many DDTs and stone cold stunners that she has lost her freaking mind.
Why is this really, really bad news for all of us, not just nurses? Part of Trump's One Big Beautiful Bill Act actually changed loan repayment programs, setting a higher annual cap for professional degrees at $50,000 a year compared to other graduate degrees at only $20,000 a year. The concern is that not just nursing, nurse practitioner, physician assistant, physical therapy, occupational therapy, social work are all now no longer considered professional degrees. This is terrible news for a system that is already struggling, where we have major nursing shortages and where there are also physician shortages, and physician assistants and nurse practitioners are filling the gaps in a lot of places, especially rural areas. Also, take a look at the types of fields that were removed from professional designation. A lot of them are female dominated. Compared to the fields that are still considered professional degrees, including chiropractic and then also theology. Now, my husband has a PhD and a master's in theology, but just to point out that that is likely on there because of political reasons. No, this is actually all part of Project 2025, where they wanted to privatize all loans, get rid of public service loan repayment, and eventually dismantle the Department of Education, which is already happening. I've also seen comments, and this is very astute, where a lot of these fields are mandated reporters when it comes to child abuse. So nursing, teachers, social workers. I have no great call to action. I don't know if a public outcry is going to do anything or if this is a done deal. Please keep talking about it. And this is incredibly important to learn the ramifications of your vote. You may do knee-jerk vote because of X, Y, and Z, but you can cause serious consequences down the line that can basically hurt the entire healthcare system and your own interests.
To the U.S. Department of Education, I just want to know, what kind of crap are y'all on? Are y'all on the pink cocaine? What are y'all on? So being a nurse is not considered a professional job anymore? So if being a nurse is not considered a professional job anymore, what's considered a professional job? Being a stripper? Being a TikToker? Like, what is considered a professional job? So the U.S. Department of Education just came out with a list of these jobs, and they're saying that they're not professional jobs anymore. What the hell does that even mean? On the list, I saw teachers. How's being a teacher not? What is going on? I feel like we live in the upside down world. What? Being a teacher is not a professional job. Being a nurse is not a professional job. Working in public health is not a professional job. Going to school and getting these degrees. Some people have advanced degrees in this field. You're telling me that is not considered a professional job anymore? Nurses, how do y'all feel? Being a nurse? Do you know how many nurses I know? Can somebody help me to understand what the fuck is going on? Because what does it mean that these jobs are not considered professional jobs anymore? Help me to understand, because I do not understand.
Y'all see that list about the professional degrees that are no longer going to be considered professional here in July of 2026? My degree's on there. And this is definitely an attack against women specifically in these fields. I have a master's in psychology and master's in social work. And I was, all throughout my undergrad and through my graduate program, specifically in social work, I was sometimes the only male in class. Sometimes there were maybe one other guy or two other guys. This is going to massively fucking destroy resources, what communities need. And all you fucking Trump supporters, all your little white kids that come to see people like me and other therapists that are suicidal because they live with you and they see how you treat them and the abuse they have to put up with in your household. When there's no longer any outlet for that, what the fuck do you think is going to happen? Your kids are going to unalive. And you voted for that. You support that. This is why I literally just made a video about this, the one before this, that said white supremacy is more important to parents than their children's lives. More important to white parents. And then when there's a massive mental health crisis in your communities and you stop the flow of resources to therapists and make us no longer available, or create a space where people getting those degrees don't mean shit, there's going to be overflow into hospitals, which are also being directly targeted. And I've been saying this for a long time. Shit is only going to get worse. And the unalive rate is going to go through the roof. See, a lot of white people didn't think this would affect them. But the suicide rates, according to race, white people are second from the top. So you shot yourself in the foot, and then it'll increase suicidality and all these other communities too. You thought it was only going to hit them. It's going to hit you too. And so remember that when you are at the funeral of your dead white children, that you chose this. You wanted this.
So did you guys see all of the female-dominated professions that will no longer be considered professional starting in 2026 summertime? And yes, there is a list. So if you went to school to be a nurse practitioner or an advanced nurse practitioner or a physical therapist or a teacher, which is a really big one, there's a lot of other ones that are on the list that are very much so female-dominated spaces. They are saying that you are no longer a professional anymore. Your degree means nothing. All the people who have gone to school for these things and worked their butt off for 4 years or 6 years, it doesn't even matter anymore because they are changing the whole system. And this is just the start of Project 2025. I do find it weird that they're only choosing the ones that women dominate. I find that really strange because it seems like to me, they are trying to take a lot of steps backward. If you are a woman and you have gone to school for this or are going to school for this, I would definitely look into this and probably raise hell. This is not okay. But you know what's weird? They have taught us what to do and how to do it and to trust in the system for so long. And then when you actually grow up and you do it, they flip the whole system. That's just what they do. They're evil people.
Remember last week y'all was arguing about whether an associate's degree is a real degree? Well, they about to tell you what's professional and what's not. These are the degrees that's going to be listed as non-professional, by the way. Y'all sitting here arguing about an associate's degree and whether it's a real degree or not, and they're coming for women's professions. Oh, and if y'all can't tell by now, they're coming for women. They say y'all going to have babies and be housewives. We're going to see to it. We're going to see to that y'all can't get federal loans. We're going to see to that. Because we're going to deem y'all degrees as non-professional. That's how they're going to do it. They're going to deem y'all degrees as non-professional. Then they're going to take away y'all federal funding. Then they're going to try to get y'all being housewives. Then we're going to have Handmaid's Tale. They see how y'all treat women. With a little push, they see how y'all can treat women, right? Y'all let women, y'all sit here and make fun of women that get punched in the face because y'all don't like them. Y'all, look what y'all did to the DoorDash girl. Look what y'all did to her. Like, y'all see how this world is going?
This is all I got from this video. And on a very serious note, you and I know exactly what they are doing. And this is more like trying to make a particular group of people to look like they never worked hard or something. But I will leave it at that. You see what is going on today is something a lot of people did not expect. Me too. I didn't see this particular one coming. I have seen a lot coming, but not this particular one. You know what it means for somebody to spend how many years in college, come out with all the money loans and all that, only for a wicked group of people to wake up one day to tell you that your degree is no longer professional. So which means you might end up not getting raised and all that. Why? Because your degree is no longer professional. And your salary may actually end up being reviewed to come down. Man, I've been seeing wickedness, but this particular one, I didn't see it coming. On a very serious note, I definitely did not see this particular one coming. but it is what it is. I feel so sad. I don't know how I feel, but I am so sad because I know so many people, so many of my friends, my family, that this will actually affect. And you too, every one of you that I know that are nurses. I know how hard this might be to sink in. I don't know who will come into power next, but if it ends up being the same group of people, I don't know if things will be getting better or it will be getting worse, because the way things are going now, it is not good. If this administration, if this Republican continue the next the next term, there is problem. But everybody have to buckle up. Everybody have to wake up. Everybody have to put their hands on other things, because I don't understand where this administration is taking us to. But one thing I know for sure is that it is not a good thing. I will draw my curtain here. Bye for now.